Hi, Mr. Vigri. My name is Kayla. I'm going to be your nurse today. How are you?
Good. Nice to meet you. I'm Jacob.
Yes, nice to meet you. So you're going to be having an abdominal surgery tomorrow. And
okay.
your doctor, Dr. Smith, has ordered that you use an incentive spirometer. Have you ever heard of an incentive spirometer before?
I haven't. Why does he want me to use that?
Well, it's good for surgical patients because it helps to keep your airways nice and open and clear.
Okay.
It does that by training your lungs to take deep breaths in, hold it, and breathe out.
Gotcha.
And it's hard to get good breaths when you're laying in bed all day. It also can help prevent pneumonia, which can happen laying in bed all day. You don't get your secretions out, and you don't take nice deep breaths. So that is why you use an incentive spirometer.
So taking these deep breaths through this will just help keep my airways clear.
Yep.
Okay, and I use this like after surgery or?
Yep, so you're gonna use it after surgery. You are going to try to do it 5 to 10 times an hour. And
okay.
I would recommend that you do it during commercial breaks when you're lying in your bed. And I would sit up when you use it so you can get a nice deep breath in and then release.
So airways clear. I'm blowing through this? Is that what?
Nope. So I'll explain the device a little bit. So you're going to be breathing in, not breathing out. So you'll put your mouth around the mouthpiece. Good,
like that?
Good effort, yes. But first, let's set a goal on the incentive spirometer. So I'm gonna need to get your height and your age.
Okay, I'm 6'6", and I'm 26.
Okay, let's see. So it looks like a good goal for you would be 4,000. So I'm gonna grab this from you. And I will mark on here with a Sharpie what your goal is.
Okay.
So every time that you use this, you want the puck to hit the goal. Then you hold your breath until the puck goes all the way back down to the bottom.
Oh, so I'm going to inhale or suck through it until it hits 4,000, then hold my breath.
Yes.
Okay, and what's good, better, best?
So, best and better is where you want to have this little yellow thing when you're taking your breath. Good is all right, but we want to shoot for better or best.
Okay.
So you want your breath in to be nice and slow and hold it for as long as you can. That keeps your airways open.
Inhale, okay.
Yep, so I'm going to have you try it for me,
okay.
And we'll see how you do. Great, Jacob. How did that feel?
That felt pretty good. A little tough, but I think I can do that a couple times an hour.
Okay.
So I'll be sure to do this 5 times an hour, usually during a commercial break,
yes.
If that's convenient.
Yes.
But as long as I'm doing this 5 times an hour when I'm awake,
yep,
that'll help keep my airways clear.
Yes.
And did I hear you mention something about anesthesia that helps with?
Yes. So anesthesia can stick around in your body for a while. So this device kind of helps to clear it out. It just helps your breathing.
Okay.
Keeps your airways clear, helps prevent pneumonia. So it's a very good thing to use.
Okay, I don't want to skip any.
Yeah, it's very important to use. Your doctor has recommended it. Also, on the back of this sheet here, there is a chart where you can measure your progress, and your doctor will want to see that. So I would just take the average, like if you hit your goal every time, just mark that you did it.
So 4,000's my goal.
Yes.
Milliliter. So
these are the days.
Yeah.
You will mark here that you hit your goal. So just every day.
So I can put 4,000 there or check mark just saying I hit my goal.
Yes.
Okay, gotcha. And I'm just doing this for a couple days while I'm still in here.
Exactly, and it can speed up your recovery. So it's very important if you want to be getting home quicker to use the incentive spirometer as much as you can. Okay. Do you have any questions for me, Jacob?
Just my last question. So how does it help get anesthesia out? Taking those deep breaths just makes you more alert, or is it?
Yes, so it can stick around in your body for a while, and when you're laying in bed, your breaths aren't as big as they could be. So getting your airways nice and clear can help just to clear out the anesthesia faster.
Okay, gotcha.
Yep.
So, should I try this like one more time? Or?
Yep, let's try it one more time just to make sure you've got it. Very good. All right, good job, Jacob. So, just a couple of quick questions to review. What is the importance of using the incentive spirometer?
It helps keep my airways clear.
Yep.
Helps me get anesthesia out of my system.
Yep.
And helps get what did you call them again? The remnants of my lungs out, right? It helps me get
your secretions out.
The secretions,
prevent pneumonia. Yep.
So this is what helps keep my lungs strong, especially after surgery.
Yes.
Okay.
And then, how often are you going to use the incentive spirometer?
So I need to use it one time an hour. I need to use it once an hour, 5 to 6 times.
Perfect.
I can use it during commercial breaks, just that's convenient during TV. But the important thing is 5 to 6 deep breaths an hour.
Perfect. Well, good luck in surgery, and I can explain this again after the surgery and when your pain level's down a little bit.
I appreciate that. Thank you.
All right. Thank you, Jacob.
Yep.